Supriya Sahu, who is the Additional Chief Secretary for the Health Department in the government of Tamil Nadu. Ma'am, thank you for your time. In the last 24 hours, since the incident that happened in the Chennai government hospital, we've seen protests also by doctors. Can you tell me, ma'am, what the Tamil Nadu government is doing to address some of the concerns that these doctors have put forth?
Yes, the government, of course, is very committed to protect doctors and to ensure the safety of doctors. We actually, about 2 to 3 months back, we have already done a security audit of all our government health facilities. And this security audit was done jointly with the police department, revenue, and the health officials, including the medical superintendents and the deans. Now, this is a very important step which actually has revealed that, there are places where the CCTV cameras are there, but there is a requirement for installation of more CCTV cameras. We have also issued instructions to all the hospitals that wherever there are dark areas, the lighting needs to be improved. And as it was mentioned during the discussion on your channel right now, I was listening to it, that, a room has to be provided for, doctors can take rest, as well as the toilet facilities have to be improved. So it's a work in progress. We have already provided most of these services in our government hospitals, and we are committed to do more. We definitely are committed to improve the security further. There is no doubt about it.
Ma'am, with regards to the incident that happened yesterday to Dr. Balaji in the hospital, do you believe it was a one-off, or do you think that, yes, there was a need to amp up security? There was some security issues that led to something like this happening?
No, I would be very honest in saying that I don't think we can, any incident, whether it is a one-off incident or it is an organized or something like that, I think we have to take it very seriously. And government has taken this incident very seriously. The person who attacked has already been arrested, and police is he's under police custody. So the case is going on, and it will follow the course of law. We are very serious, and we are in talks with associations also. The doctors' associations came yesterday. They have also made several suggestions. The heads of the institutions have given several suggestions. We definitely are working on all these suggestions. In fact, most of these big hospitals, especially in metro cities like Chennai, you have large number of people accessing the outpatient services. So we are also looking at how do we make sure that the visitor passes can be introduced so that, the access can be regulated. And it is not that everybody kind of, enters where you just do not know what is happening. So in one of our big hospitals, which is the RGGH hospital, one of the largest hospitals, we have already rolled out the visitor pass system, and we'll be doing so in all other facilities.
With the incident that happened yesterday, it's understandable how medical professionals right now across Tamil Nadu, across the country perhaps, are feeling unsafe, are worried about their safety, are worried about what's happening while they're on duty. And that's why we've seen protests taking place across Tamil Nadu. Has the government, ma'am, also made any effort to reach out to these doctors, kind of reassure them that their safety, security is taken care of?
Yes, the Honorable Chief Minister has already made a statement on his Twitter account. The Honorable Minister has been also making several statements in the press. Yesterday, we had a long discussion with the Doctors Association. We have also been talking to the doctors separately also, wherever they have reached out to us. We have told them that in spite of the fact that we have already kind of assessed the security situation in all our hospitals, we are also strengthening the police outposts in larger institutions. For example, the Kalangar hospital, where the incident happened yesterday, it has a police outpost, but it was located little bit outside. So now we are shifting the police outpost closer to the hospital entrance. And I think this is one thing that we have learned, that in hospitals where large number of people are accessing, the police outposts are important. We have to make sure that the availability of the police personnel should be in the vicinity. So I think it is very important that we discuss with the doctors and find out what their suggestions are. We are working together as a team to kind of rectify wherever the
Okay. And finally, my question to you, ma'am, is considering that this incident happened and the accused was the relative of a patient, was clearly frustrated with the treatment and the course it was taking, do you also think that there needs to be a certain amount of awareness among patients, among their families, that needs to be spread so doctors aren't targeted in this manner? Because 24 hours on, there was another incident also reported of a doctor being assaulted.
No, I think one thing which is very clear is that we need to definitely bring systems which will kind of, reduce the stress on the system. So it's very important that we have a kind of a mechanism where patients can also call up and clarify their doubts. Government of Tamil Nadu has been running a call center, which is a toll-free number 104, where patients can call up. We have 40 people who are working. We have an exclusive counseling number also, which can be accessed by people. I think it is important. We have also realized that more awareness needs to be generated about these call centers. And perhaps in larger institutions, we are also looking to see whether we can provide more volunteers and, kind of counselors who can also take care of the stress in case of a terminally ill patients, so that there is some kind of a stress management and as well as counseling is going on. There is no doubt that these facilities, they play a very important role. Yes.
We will do our bit also to ensure that there's more awareness on those call centers, on those helplines. Supriya Sahu, thank you very much, ma'am, for joining us here on India Today and taking all of our questions. Incident, yes, is worrying, but she's promised us that the government is taking this very, very seriously and ensuring that doctors who are right now worried for their safety, their issues are also immediately addressed.